Hi, Namaste. I welcome you all to Hum discussion. Today we will start the new disorder for further discussion. But before moving on to it, I have to tell you, if you want to know about the neurodevelopmental disorder, go and have a look in the playlist of my YouTube channel. Thank you. So our topic for today is schizophrenia and other primary psychotic disorders. So these are a group of disorders characterized by a significant impairment in reality testing. That means person's contact with reality is impaired and people interpret reality abnormally and there is an alteration in behavior. That means individual personality is seriously disorganized, and these are manifested in different symptoms like delusions. And delusions are a false fixed belief that cannot be corrected on a rational ground, or these may be manifested as hallucinations. And hallucinations are false perception where patient sees, hears, smell, taste or feel things that do not exist in reality. Or there would be a formal thought disorders manifested as a disorganized speech. In that, patient has difficulty in concentration and maintaining a train of thought. And sign of disorganized speech involve loosening of association. That means rapidly shifting between topics and there is no connection between topics. Next sign of disorganized speech is perseveration. That means repeating the same thing over and over again. Next may be a use of rhyming word without any meaning. Or the impairment in reality testing and alteration in behavior may be manifested as a disorganized behavior. So it is a strange or unexpected behavior which is usually out of the context for a given situation. For example, lack of impulse control or shouting when expected to be remain quiet. So all these may be accompanied by a psychomotor disturbances, that means abnormal movement. For example, hyperkinesia, akathisia or catatonia, or are negative symptoms also. And negative symptoms are due to the reduction of normal behavior responses. And these symptoms include affective symptoms, that means patient shows little or no emotions on their facial expression, or there may be a poverty of speech. Anhedonia also, that is inability to feel pleasure or social withdrawal. And these symptoms respond less to the medication as compared to the positive symptoms. And these symptoms do not occur primarily as a result of substance use, for example, hallucinogen intoxication or another medical conditions, for example, Huntington disease. The disorders in this group are referred as a primary psychotic disorder because psychotic symptoms such as hallucinations, delusion, disorganized thinking and disorganized behavior are their defining features. The schizophrenia and other primary psychotic disorder includes many other disorders. For example, 6820, that is schizophrenia, 6821 schizoaffective disorder, 6822, that is schizotypal disorder, 6823 acute and transient psychotic disorder, 6824, that is delusional disorder, 682Y other specified primary psychotic disorder, and 682Z, that is schizophrenia or other primary psychotic disorder unspecified. Important points we have to take into consideration for schizophrenia or other primary psychotic disorders are: belief vary across cultures such that those considered odd or unusual in one culture may be normative in other. For example, distress due to social circumstances may be expressed in a way that may be manifested as a evidence of psychotic symptoms such as pseudo hallucination, overvalued ideas, or dissociative experience related to trauma. Symptom presentations may vary across culture. For example, the content and form of hallucination. For example, visual hallucinations are more common in some cultural group and in some countries. Or delusion may be culturally deprived. For example, in some cultures, it is common to expect the spirit of a deceased relative to visit the home of a living relative soon after they die. So, hearing, seeing, or interacting with this spirit may be reported without notable pathological sequel. So, clarifying the cultural meaning of these experiences can aid in understanding the diagnostic symptoms of presentation. So, collateral information from family, community, religious reference group, or cultural reference group may be helpful in clarifying the diagnosis. If this video is helpful for you, please like the video and subscribe the channel. Thank you.